Welcome back, folks. So let's talk seriously for a moment. Do you suffer from headaches, neck, ear, or facial pain? Does your jaw click sometimes? I'm no dentist, but I know that's not supposed to happen. It could be TMJ. It's a painful condition, but there is help out there if you know where to look. I want you to welcome to the show this morning Dr. Dwayne Keller from Keller Professional Group and his patient, Amy Zabel. Amy, Dr. Keller, nice to have you both here. Amy's got a great story that I think a lot of people are going to relate to, and we'll talk to you in just a sec. But first, Doctor, we always like you to sort of set the table for us and talk about TMJ for people that aren't familiar with it.
Well, it's a temporomandibular joint, but what we're looking at today is one of the sort of offshoots of it, a thing called Meniere's disease, which is an inner ear problem, but some of the bones of the inner ear actually develop as part of your jaw, and through the development migrate up to the ear. So there's a structural, a vascular, and a neurological connection between your jaw joint and some of the ear problems. And sometimes we get people like Amy that come in with some really debilitated problems.
Well, and we've talked to you in the past about people who've had neck pain, sometimes even radiates down your back, but it's all, you know, your head is not Swiss cheese. Everything's sort of interconnected, and a lot of it goes back to these jaw issues. So Amy, let's talk about your story. You dealt with problems for a long, long time, didn't you?
Absolutely. Severe debilitating vertigo. And it would be the kind where you would just be walking or driving or doing any kind of regular activity, and then you just all of a sudden get sporadic severe vertigo. You would just drop. And I used to call them drop attacks. And those people that suffer from Meniere's disease understand what those are. And I was way too young to be debilitated. So I went to a lot of different doctors, ear, nose, and throat specialists, and they all kept telling me, this is debilitating, you may have to retire. I'm sorry, this is a grim diagnosis, you're just not going to be able to, work or live a normal life. And I just was unwilling to accept that.
But you're from the Atlanta area, a little bit south of Atlanta. You
That's
said
right.
you were fortunate to find a good oral surgeon down there who was at least able to point you in the right direction, right?
Exactly. Dr. Moeller was great. He had dabbled in some of it himself, and it was kind of like a hobby for him. And he was in the St. Louis area and got in touch with Dr. Keller, and they met, and he actually observed some of his patients. And he got back home and called me and was super excited and said, Amy, these are the only people in the country that can help you. So we got in touch, and I've been coming here for almost 4 years. It has been a long journey, but it has been worth it.
So what have you been doing to help her out?
Well, the main thing is we had to diagnose the fact that part of her ear symptoms were related to a joint dysfunction, her jaw joint dysfunction, and we had to work through that. We worked with physical therapists. Dr. Hereford at Core Physical Therapy was excellent in helping us do that. So through a combination of changing sort of the structural functional misalignment to a better alignment, we've been able to reduce the symptoms to where I think you're pretty much symptom-free now for a couple of years.
Is that true? Big improvement, huh?
Exactly. It's been over 2 years since I've had an episode.
Wow. Congratulations. And I know your husband, who's here watching, too, appreciates that. He used to have to drive to pick her up, literally, sometimes, from wherever she had one of these dropping spells. My goodness. Thank you both for being here, Dr. Keller and Amy, and continued success to you.
Thank you.
If you're experiencing these problems, discuss them with your dentist or give Dr. Keller a call. Folks are coming from Atlanta to see him. It's like he knows a thing or two about it. Area code 314-638-4190. He'll help you find out why you have the pain, what can be done about it. And you can check out his website, too, which is drdwaynekeller.com to learn a whole lot more about TMJ.